I'm glad. Okay, we're going to go ahead and get started. A lot of people have asked for napkins and they've gone to get some, so we'll just kind of walk around with them when they get back with some. I told you to eat with your fingers and didn't give you any napkins. That was kind of not nice, was it?
That's all right, it's country.
Well, somebody just grabbed my shirt back there and said they will use my shirt since I didn't give you any extra napkins, so I sent somebody to get some. Okay, we're going to go ahead and get started, though. We are so pleased tonight to have Dr. Rival and Dr. Poe here tonight to talk with us about hearing loss. I know somebody's going to say it. Go ahead. What? Well, I made sure that we had extra batteries in the podium so that the microphone was good and clear and loud tonight. I didn't want to have to hear that because I knew I'd get some flack about that. Not that any of y'all would do that. So we're going to go ahead and get started. If you need anything, just kind of let us know. We'll be circulating around. But Dr. Rival, you'll come over. He's going to tell us a little bit about himself and do his presentation, and then he'll introduce them. I think, Dr. Poe, you have your own little presentation for us, don't you? That's wonderful. Thank you.
Thanks, Tracy. Does this podium slide up at all, or is it kind of fixed?
Oh, no, you can move it wherever you want.
I just want to be able to see my slides. Hello, everybody.
Hello.
The people in the back of the room must have the best hearing, because they're furthest away from me. Thanks for coming out tonight. It's a pleasure to be here. My name is Dr. Rival. I'm an ear, nose, and throat doctor. I have an office in Petersburg near Southside Regional Hospital, and I come down to Emporia once a week on Tuesdays and run a clinic here on Belfield Drive. And there'll be more information. We have cards and whatnot for anyone who might need that information. A little bit about myself. I am about in my 4th year in practice. I trained in Boston and spent my first couple of years in practice in the New York, New Jersey area. And I quickly hightailed it out of there to Virginia, because New York and New Jersey was adding 5 years to my life every actual year. My wife grew up in Suffolk, and we had kids, and we knew this was a good place to relocate. And this area also needed more ear, nose, and throat services, so everything kind of worked. And I've been here for about 5 months now, and we are happy to be here. And I'm especially happy to be in Emporia. Our clinic down here has become very busy very quickly, and we appreciate the support of the community, and we hope we can be helpful to everyone here. So when Tracy had asked to come and give a talk, there's so many things we can talk about in ear, nose, and throat, but one of the most common subjects I will get asked about is issues with hearing loss. So I'm going to cover some basics regarding hearing loss. How do we diagnose it? What causes it? And then Dr. Poe, who is our audiologist in our office, will go a little bit into things such as hearing aids and how she approaches a patient who I will end up sending to her for further evaluation and treatment for the hearing loss. So when you talk about hearing is one of our 5 special senses. So we all grew up knowing about touch, taste, smell, etc., etc. Hearing is one of them. Hearing loss can occur at any age, from children being born with it, and obviously it occurring in advanced age due to just age-related nerve damage. Hearing is broken down into 2 categories. So you can lose the hearing from a mechanical problem, such as wax blocking your ear or a hole in your eardrum or something of that sort. But you can also lose the hearing from more of a nerve kind of problem, or something with the nerves or conducting that sound to the brain, where hearing is actually processed, and that's where you realize what you're hearing. So to go into the anatomy a little bit, I'll try not to get too specific with things, but this is what it looks like if you slice through the ear right in the middle of it and look at what... Tracy, does this have a pointer as well?
Yes.
Okay, let's see. Oh, good. Here's an ear. What you see on the outside, this little channel here is the ear canal. This area right here is the eardrum. These white colored areas right here are the bones that wiggle in your middle ear. When those bones wiggle, they end up causing fluid in this snail-like organ. The fluid turns into waves, and those waves is what makes the nerves send a signal to the brain. So really we're talking about the mechanical problems. We talk about, is there something wrong with the ear canal? Is there something wrong with the eardrum? Is there something wrong with the bones that are behind the eardrum? That would be a mechanical problem. When we talk about the nerve problems, we're talking about this snail-like organ, which is called the cochlea, and that's what we call the inner ear. And the nerves of our inner ear are in this snail-like organ, and this other area right here is called the semicircular canals. I won't get into that too much, but that's where our sense of balance comes from. That's why if you have dizziness or something, your doctor says, go see an ear, nose, and throat. You say, why am I seeing an ear doctor for dizziness? Because our center of balance actually happens to be in our ear. There's two nerves coming out of the inner ear. One nerve that takes the sound waves, and one nerve that takes our balance signals and takes it to the brain, and our brain figures out what's going on. So what are some signs of hearing loss? Well, when we see it in children, they don't learn words fast enough, or they don't listen to their parents. Now, a lot of kids don't listen to their parents because they just don't plain want to. I diagnose that a lot too, but many of them don't hear well because they have problems they're born with. They do poorly in school, or they might have behavioral problems because they weren't hearing well. In adults, people can present with lots of different things that can cause hearing loss. Many in this room might have ringing in the ears, and one of the first signs of hearing loss is ringing in the ears, or what we call tinnitus. Ringing can be anything from high-pitched to chirping to ocean waves to, I've heard everything, mechanical knocks like a backed-up radiator or something like that. So people can get any kind of sound that causes tinnitus. Poor hearing in crowded environments. So if you're at a restaurant and trying to listen to the person sitting across you, but there's a lot of noise going on, you might have trouble. You might notice people are reading your lips, or you're reading people's lips, and that's one of the signs of some hearing loss as well. Everyone has that person in their family who has a TV on too loud, another sign of hearing going down. So when we talk about the two types of hearing loss, one is called conductive, and by conductive we talk about those mechanical troubles. So, any problem that's blocking the mechanical transmission of sound. So, wax in that ear canal, that's not going to let sound waves get through. If your eardrum is stiff, or if there's a hole in the eardrum, may not work well. Fluid behind the eardrum, if you've ever had an ear infection after a bad head cold or something like that, and you feel like there's water in your ear, or you just feel a clog in your ear, that's usually because you have fluid behind your eardrum. That doesn't allow those sound waves to go through easily either. And then problems with those bones that I was talking about, those little bones in the middle ear. There are conditions that can occur at any age that can cause the bones to become stiff, or the bones can become worn down, not allowing the sound waves to go through. So people can get these problems if they have recurrent ear infections. There is a chronic condition called cholesteatoma, which basically is almost like a cyst that happens behind the eardrum that can chew away at the ear bones. Trauma, anyone who gets slapped in the ear or sticks a Q-tip too far in or anything of that sort can cause a problem. I mentioned that the ear bones can get stiff. There is actually a disease called otosclerosis, which is actually a genetic disease that can cause the ear bones to be stiff. This tends to run in families. Anyone who's had prior ear surgery, and then pretty rare, but anything else like a tumor or a growth in the ear can obviously cause the hearing to go down. So this is what just a drawing of what it would look like if you had a hole in the eardrum. This is a eardrum this is what a normal eardrum looks like, and then this just shows a tear in the eardrum. And if there's a tear in the eardrum is not going to vibrate normally, and so you're not going to hear correctly. Over here, it's showing what it would look like if there's a gap in the bones of hearing. And so this the bones of hearing in lay terms are the hammer, the anvil, and the stirrup. There's a gap here between the anvil and the stirrup, and that can happen after people have had lots of infections throughout their lifetime. And then there's the nerve type of hearing loss, or the inner ear hearing loss. So that happens when there's problems with the function of that cochlea, which is that snail-like organ, or those canals that are the center of our balance in our inner ear. So you can also have problems with the nerves that go between the inner ear and the brain. And then you can also have a problem within the brain itself that's causing the signal not to get there. So there's a few different places that nerve hearing loss can occur. What are the causes of it? Well, probably number one, and probably frankly most commonly amongst our group here, is going to be age-related, what we call presbycusis. And you probably heard from your doctors all the time, oh, it's because you're getting old, oh, it's because you're getting old. And I unfortunately have to say that a lot too, people who come in with hearing loss. Other things, however, can be in play as well. Noise exposure. So people who worked in factories, and many folks in this room might have worked in a factory or in a place of employment before regulations were in place that you had to wear certain types of ear mufflers and sound protection and such. So people who worked in factories or loud places can have, or just musicians, can have noise exposure hearing loss. Medications can cause hearing loss. So most commonly it's chemotherapy medications and strong IV antibiotic medications are the ones we see most commonly causing hearing loss. Genetics or hereditary causes, people might have hearing loss in their family, and that's the reason why they have hearing loss. There's a condition called sudden neural hearing loss, and we don't really know 100% why that happens, but we think it's probably some kind of viral infection of the inner ear. You can wake up one morning and one ear can just be deaf, or it can be significantly decreased. So I always tell my patients, or any group I talk to, if you ever wake up one morning or notice you got on the phone and all of a sudden it just didn't sound right, it might just be a piece of earwax, but it might also be a sudden hearing loss, so get that checked out immediately. If we can see someone within the first week of that happening, we can oftentimes get it better. Prior ear surgery or trauma can cause nerve hearing loss. There's a condition called Meniere's disease, which causes vertigo as well. Infections such as meningitis. And then other health problems can sometimes cause it. We know that there's a connection between high cholesterol and hearing loss as well. So I'm going to focus a little bit on nerve-type hearing loss because it's probably more relevant to the group we have today. Nearly 30% of people over 65 have some decrease in speech reception. Okay, it's usually equal on both sides, and this is with people who have age-related hearing loss. Usually it should be equal. If it's not equal on either side, it's something we need to look into. And usually it's progressive, and for everyone it's different. Some people might have a stable hearing for 5 to 10 years, and it goes down after. Some people might have a drop that goes pretty significantly over 5 years. Everyone's different. With noise-induced hearing loss, there's sort of two things that can happen. You can have a chronic low-intensity noise exposure. I use that example of a factory worker, but this also is people who, say, truck drivers who are always on the road and have that chronic noise there. People who are musicians who are exposed to music and that noise for a long time. And then there's acoustic traumas, or someone who gets exposed to a really loud sound suddenly. Like anyone who's a veteran here might have had an explosion or a gunshot near them, and they might have had a ringing in their ear, might have lost their hearing or had decreased their hearing afterwards. So that's a different kind of noise trauma. It's kind of a sudden, loud trauma. In terms of the medications that can cause, as I mentioned, antibiotics and chemotherapy are the most common ones. With people who are on long-term diuretics, like something called Lasix or furosemide, people who have been on long-term high doses of aspirin, not your baby aspirin. A lot of people here might be on baby aspirin, but long-term high dose of aspirin can cause it as well. Meniere's disease is a condition where you have excess inner ear fluid pressure. The symptoms are a pressure in the ear, ringing in the ear, dizziness, and hearing loss. There's usually those four things. And we can usually manage that with changes to the diet and maybe some medication. So how do we diagnose someone with hearing loss? Well, First, we see you in the office. We do a complete physical examination. We want to look at your ears and examine it and make sure that everything looks anatomically normal. Then we do some diagnostic tests. So we do a hearing test, or what's called an audiogram, and Dr. Poe will talk to you more about that as well. We might get some possible blood work if we're concerned that it might be something else in your medical history that is causing you hearing loss. And then in certain situations, we might want to send you for more testing. If, as I mentioned, if your hearing loss is not equal on both sides, if there's something going on that makes me think that we need to investigate further, we might end up getting a CAT scan or an MRI scan to look into things further. When you get a hearing test, you sit in a soundproof booth with headphones on, and I'll let Dr. Poe talk to you more about this. Audiologist sits on the other side and runs the test. The graph looks kind of like this. The blue X's is your left ear, the red circles is your right ear. And this is just an example of what someone would look like who has high-frequency hearing loss. You see it kind of looks flat up here, but then it drops down and looks and it has a decrease down in this area, and that's something that we can see with age-related hearing loss. So what's the treatment of hearing loss? Well, number one is prevention. So anyone who has exposure to loud sounds, we try to do as much as we can to make sure that they're protecting their ears with earplugs or whatever it may be. Surgery can play a role in certain cases. For example, if someone has a hole in the eardrum, we can patch it up. If someone has ear bones that are missing or broken, we can repair those. People who have deafness in one ear or who have significant what's called conductive hearing loss, there's a surgery called a bone-anchored hearing aid. Anyone in this room have a dental implant? A dental implant is like a titanium screw they put into your jaws to help you put basically a fake tooth in to make it look like a real tooth. Well, we can put a similar kind of screw behind the ear that a processor can be hooked up into, and that processor will make vibration sounds and allow you to hear even if you have deafness in that side. I'll explain that a little bit later with one of my future slides. Then there's something called cochlear implants. That is a surgery that is meant for people who are deaf, completely deaf in both ears. That's a surgery that's gained increased popularity in the past 10 to 15 years and has a very good success rate. And then the simple thing is amplification, meaning hearing aids is the main source of amplification. And then there's other things out there like FM systems. People, children who have hearing loss who can't hear their teachers, we may have their teachers wear a microphone. The child has an earbud in their ear so they can hear their teacher more clearly without worrying about where they're sitting in the classroom. You might have seen commercials for something called TV ears, something you wear around your neck that picks up the sound from the TV and gets it right to your ear. There are some newer options out there. There's something called trans ear, which is a non-surgical option for people who have deafness in one ear. There's something called bone bridge, which is an alternative to that bone-anchored hearing aid. Sound bridge, which is an implant that can actually put behind the eardrum. There's something called lyric, which is the entire hearing aid can be put deep in the ear canal, so it's something anyone would ever see. And it can be kept in the ear, doesn't need to be removed for about 3 months. And the future of hearing research, well, we're trying to focus on ways to regrow inner ear nerve cells. The biggest problem with nerve hearing loss is that our nerves don't regrow. And that's why when you lose your vision from aging, you can't get it back. You lose your hearing from aging, you can't get it back. Someone who has a stroke can't get that back, and so on and so forth. But birds can regrow their inner ears. So we're doing research on bird inner ears to find out how can we figure out a way to regrow our inner ear cells. This is our contact information. We have in the back, and Dr. Poe will talk to you as well, our some pamphlets, our business cards, and appointment information. Our number is here. We do come down to Emporia on Tuesdays, every Tuesday. Additional things we do in our office, we take care of sinus and allergy problems, vertigo and balance problems, snoring and sleep apnea, hoarseness and swallowing problems, facial skin cancers, neck tumors, and we also take care of kids. I appreciate your attention. I'll turn over to Dr. Poe. Dr. Jessica Poe is our our doctor of audiology in our practice, and she graduated from West Virginia University, and she will talk to you a little bit more about what she does in our practice, and she'll probably be able to answer any questions about hearing aids and things better than me. So if you have any questions about hearing aids, about how does it work, what's the process, I want you to ask her those questions, and then maybe what we'll do is when she's done, we'll both take some questions. Okay?
Hello. Oh, like he said, my name is Dr. Jessica Poe, and I moved here to Virginia about a year ago from West Virginia. I just grew up there. No kids yet, but I have a dog. So what I'm going to talk to you about is, if you do have hearing loss, what can you do about it? I mainly run mine out of the Petersburg office, so we are working on getting hearing aids started up. So what we're going to be able to do is have some hearing aid services if you find that you do have a hearing loss. Okay, I already messed this up. Okay, so first off, what I do is just a main hearing evaluation. So what we do is we just look at all of the whole process. We look at your speech understanding. We look at how well you can hear certain sounds, certain beeps. So we stick you in this soundproof booth, and I sit on the other side, and we test your hearing. So we have you listen to different tones at different pitches. They come in at different loudness levels. And then I also have you repeat some words to try to get your speech understanding. And with those tests, it takes about 20-30 minutes or so, and I can get a really good picture of your hearing. And it's in a really good situation because it's in a soundproof booth. It's not loud. So we're really pinpointing what your true hearing looks like. We do that with an audiometer, of course. All right, I'll get this. Okay, so this slide right here is what I call the speech banana. This is the audiogram, which is similar to what Dr. Rabel showed you, where there was a graph of your hearing loss. Typically, when we look at this, normal hearing falls above this 20 line right here. So most people are right around there. But if you have a hearing loss, you might slope down and see different things. Now what this shows is different everyday sounds that we hear and where they come in. So if you have normal hearing, you're going to be able to hear the water running and maybe the baby crying and leaves rustling and some birds. But say you had a hearing loss that started under here and it kind of went down. You might miss the water running and you might miss the birds. Down here we've got some different speech sounds. So if you start to have a hearing loss that cuts down, that's why your speech understanding is bad. But with hearing aids, what we can actually do is bump it up so that you can hear those things again. So that if you were an avid bird watcher in your heyday, you can hear those birds again, or you can hear the baby crying and things like that. So this just kind of shows what you might be missing with a hearing loss. So in our office, after we do a hearing test, we do what's called a hearing aid evaluation. We work with Widex, which is a great hearing aid company, and we let you pick the type of hearing aid that you like. There's different sizes, there's different colors, so if you want to be discreet, you can have a skin color, or if you want to be wild, we can get you zebra or lime green or something like that. But actually what's really neat about these hearing aids too is that they're actually programmed specifically to your hearing loss. You can't just come and pick up your friend's hearing aid and put it on and think that it's going to work well for you. What we want to do is make them customizable. So after we do your hearing test and get your audiogram, we plug it into the computer, and we're actually able to hook up the hearing aids and make it specific to you. So we can give you a bump where you actually need the help. Oops. I'm not too good with this clicker tonight. And then with the hearing aid fitting, we teach you how to use it, of course. We make sure that it's helping you, because it's a good investment. And we're just making sure that before we send you home, we teach you how to use it and how to keep track of it. I know this picture is kind of small, but it shows different types of hearing aids that we have. There's one that's completely in the ear canal, and of course, all these ears right here, I honestly can't even barely see the hearing aids anyways, but this one is completely in the ear canal. There's one that kind of fits right in the canal and one that's a little bit bigger there. one that fills up a little bit more of the bowl of the ear. And then we've got the behind the ear hearing aids, where you have actually a piece that sits right here. If you wear glasses, it kind of sits there right next to your glasses, or sits there like your glasses would be. And you have a tiny little thin tube that comes down and filters all the sound into your ears. But again, it's patient preference, whether you think that you want one that's completely in the ear or want one that's behind. We just help you find the one that's most comfortable for you and the one that you're actually going to wear and not just stick in your drawers. Then we don't just let you go, take you with the hearing aid. We actually follow you, have you come back into the office and make sure that the hearing aid is good. In our office, it's really quiet. It's not a real-world situation, so we want you to take the hearing aids out and go have dinner with your family and see if you can hear them better and see if you can have a better conversation with somebody. Because if you can't hear anything and you can't participate in conversations, it's not very fun. So it definitely improves the quality of your life if you can go out and you can do the social things that you used to do just because we got you a hearing aid. So we follow up. You can come in and see me. You can call me anytime. And repair services, they don't break too often, but they're there too. But contact information, I need to put this down. I've got a business card. I'm going to be actually running the hearing aid services out of the Petersburg office because I need the computer and all of the testing equipment and things like that. But come in and see us anytime. I've got cards back there, and I've got some brochures about the different hearing aids that we have, and actually some examples of how tiny they are back there too. So you guys have to check that out. But that's it.
I have to go find them, but I didn't put any back.
Okay, I'll go find them and put them back in.
Okay, I'm going to bring the lights up so you can see you all. All right, does anybody have any questions for either of our presenters tonight?
Go ahead.
I know a lady that got one. I think she got from y'all. Goes in the ear, and afterwards, it ought to get in and they said it wasn't any problem. I mean, just put it in, let it stay in, or...
Yeah, actually, if we're getting one for you that fits actually inside your ear, what I do is kind of make a mold of your ear with something that kind of similar to silly putty, Play-Doh. So we actually inject it into your ear, let it harden, and pull it out, and there I have a mold of your ear canal, and send it off to the company, and they make hearing aids that fit exactly in your ear. So they're really easy to get in, and we work with you to make sure that you can do it before you leave. Honestly, well, you can get an appointment as soon as you call us. We can get you in. But sadly, we don't have a lot of help from insurance companies and Medicare and things like that with hearing aids. Audiologists are always trying to fight to get them to make rulings that they'll help us. But currently, right now, it's self-pay with hearing aid services. We're trying to work out some things with our hospital about payment plans and putting half down. But
Same goes for testing.
Oh, testing covered by insurance is mostly, you get a hearing test a year, I believe, at least with Medicare. And so you can at least come in and get your hearing tested and see how that is. Sure.
Questions?
Are you supposed to hear yourself talking when you're talking with them in the ear? I'm talking louder, I think it is, and she said I have to talk louder so you can understand what I'm saying.
Are you supposed to hear yourself talking? Is that what the question is?
Yeah,
I think I'm talking loud enough when I'm talking to her.
Mm-hmm.
But she said, I can't understand you, you're not talking loud enough.
I think that might be her selective hearing.
Yeah. So he asked the question of, are you supposed to hear yourself talking? So yeah, people who have hearing loss, tend to talk louder usually because we learn how to control the own volume of our voice because we're supposed to be able to hear our own voice. So if your hearing is down, then you won't perceive your voice to be as loud, so you'll talk louder. Now, it takes two to tango, so you may be talking louder, but if the person you're talking to is not hearing you as well, then it becomes a problem.
Oh, I hear.
I use that as a very general example. I don't want to select you two out. My goal is not to create any conflict here.
I didn't wear them tonight because I've been so loud in here I couldn't hear you. I couldn't know what you were saying, so I didn't bring them.
Yeah. Yeah.
But really, when he puts them in, he said he sounds so loud on the inside that he's afraid he's too loud on the outside.
I feel like I'm hollering at you, you know.
Well, there's different programming and different things that you can do with the hearing aids where you can change the programming so that you don't sound so loud to yourself, and you can always make changes. So I would suggest going back to where you have your hearing aids and telling them your problems, and they can make some changes.
I don't think I need them.
He needs it. He's one of these that's television, you know, it's so loud that the room starts dancing.
Over there in the back, go ahead.
You were talking about vertigo. I was wondering, you were saying that the things that you could change in your diet. What kinds of things are you talking about besides medication?
So, having vertigo is like having a cough. There's 101 things that can cause it. Okay, so everyone who has vertigo for a different reason. There's some cases of vertigo that can be either worsened or triggered by certain things in your diet. But there's many other cases of vertigo that won't change at all with what's in your diet. So take what I say with a grain of salt because it doesn't go for everybody. But in some cases, people who reduce their intake of caffeine, alcohol, sugary, fatty, and salty foods. Now that means you can have no fun. They will oftentimes have less vertigo. And the specific example is a condition called Meniere's disease. I talked about that a little bit. Meniere's disease is a condition where you get excessive inner ear fluid. And we sometimes have people try a low-salt diet first. And if that doesn't work, or if that works a little bit, we can put them on medications that can actually make them release a little bit more salt than they're supposed to and get some of the fluid out of their inner ears. But people who have vertigo can get their vertigo triggered by caffeine, alcohol, sometimes high sugar or high salt. I get a lot more calls around the holidays for vertigo than the rest of the year because people are eating bigger meals, usually saltier meals. And that doesn't always mean that they have Meniere's disease, but they might have retained more fluid, and that more fluid retention doesn't always go to your ankles, it can go to your inner ears. And that can cause vertigo. So that is something to think about, but it doesn't go for everyone. It's only if you have certain specific problems. Yes, ma'am.
Oh, I wanted to ask a question about your sinuses and allergy. Okay, if your nose is really stuffy sometime and then your eyes are really itchy, what's the best way to get rid of it?
Well, that sounds like allergy.
Yeah, it is allergy. I do have allergies.
Yeah. So that's a complicated question. There's a lot of ways you can treat allergy, and that's a whole separate talk I have that I'd be happy to give at a future date.
Okay, I just thought I would ask.
No, but to answer your question, as briefly as I can, without going into too much, it depends on what you're allergic to. Avoiding what you're allergic to is an important part of things. Treating it with certain medications is important as well. There's nose sprays that can be used. There's antihistamine medications that can be used. And then if those things don't work and your symptoms continue, finding out exactly what you're allergic to and doing something like allergy shots, so to speak, can help you out with that as well. So it's a pretty broad, topic, but that's kind of a basic idea of what can be done.
Okay, thank you.
Sure.
Any other questions?
A lot of people do take showers, and some people, I don't know if they take sit-down bath or not, but when you take a shower and sit and wash your hair, your water goes in the ear, it's fine. But some people take a bath and sit down and they wash their head on the water. What causes your alcohol?
So you asked a question about basically about getting water in the ear and that kind of thing. So our ear canals are naturally self-cleansing, which is why any doctor will say don't use Q-tips. Water in the ear is okay. The water will dry up eventually. If you get water in the ear and you feel like it stops you up, it's probably because that water is mixing in with some earwax. It's probably not the water itself all the time. But having water in the ear is okay. It will eventually evaporate. The problem is when you get like lake water or pond water in the ear, and if it stays for a long time, doesn't evaporate quickly enough because it's humid or something like that, then you can sometimes get something called swimmer's ear. I don't usually recommend anything regular in terms of cleaning the ears after a bath or a shower. Nothing bigger than your pinky finger should really go into your ear because the skin in the ear canal is really fragile. And I don't know if anyone here has ever had their ear bleed, but it can bleed very easily if you put a Q-tip in too far or something like that. It can also jam the earwax in further and making it much harder for it to come out. I always suggest to take a washcloth with your pinky finger and go as far as that can take you. You can't hurt yourself doing that. Some people have smaller ear canals or ear canals that are curved in any which way. Sometimes they have a little bit of a harder time feeling like they get water out of their ears. Simple thing that can help you: blow dryer about 2 feet away from your ear for a couple of minutes. Can't hurt it. It'll help you dry your ear out faster. Just don't burn your skin. So that's a good question. Some people have chronic ongoing nasal drip. Doesn't matter what time of year, doesn't matter what season. In those folks, it can still potentially be allergy because we're actually allergic to as much indoor as we are outdoors. So it doesn't really matter what season it is. It can just run all year round, depending on what you're allergic to. However, again, not to sound like a broken record, but nasal drip is actually higher in seniors than it is in the rest of the population. And the reason why that we think that happens is because over time, the nose, the glands that make the mucus in the nose just sort of start going on their own without anything requiring it to get irritated. We don't know why that happens, but it may be allergy, it may not be allergy. The bottom line is we tend to treat it the same with certain types of nose sprays and things like that. So whether it comes from allergy or not, we try to treat it. Some people can get a more of a runny nose with certain types of foods or during eating or when they go from cold to hot or hot to cold. And that is oftentimes caused by just the change in temperature causing the nose to run more. So there's lots of things about runny noses we don't know, as simple as it sounds. We can't cure the common cold yet. We can't cure the common nose drip sometimes as well. But it could be allergy, it couldn't be allergy. That's sort of my very, very non-committal answer to you. Yes, sir.
Going back to the wax, I think it's been 50 years ago, I was there and saw my ear stopped up to the plug and told the doctor he couldn't get it. And he suggested to me that I've been doing it periodically. You know, sweet oil, you put it in there, let it stay overnight, and you flush it the next day. And I do that once every 2 or 3 months. I ain't had to do it for like this.
Yeah.
What it was doing was building up.
Yeah, that's fine. I don't. Like I said, I only warn people against the Q-tips and trying to get, even I can't even get my own dad to not put his car keys or something like that in his ear. So I only worried about you sticking something down there. If sweet oil and flushing it works for you, that's fine. People can get buildup from dry skin in the ear, and that's where the oil helps because the oil lubricates the skin. I have a lot of patients who I see regularly just to clean their ears, and that's not. You go to the dentist every 6 months to get your teeth cleaned. It's very reasonable to see an ENT for 10 minutes and just get your ears cleaned every once in a while. So if I have a patient who has a lot of buildup, I usually recommend, why don't you come back to see me in 6 months, clean you out again, or then we'll start doing it every year and just keep it clean. I think that's a safe way to do it as well.
The same doctor said don't put anything in the floor, then you bring your little finger.
Yeah.
He's in the elbow.
That's fine.
Yeah. Yeah. Well, I mean, I'll give you a little bit more than your elbow. I'll give you your finger.
Any other questions?
Have you heard?
When you put the oil or the earwax to soften it up, what's going to get it out if you're not supposed to put a Q-tip in there? How's it going to go out?
Well, the reason why wax gets built up is because it ends up becoming either too thick or too dry for our. We have little hairs on the surface of our ear canals that sort of help push the wax out towards the edge. And so when people get earwax stuck in, it's usually because it's too thick or too dry for that mechanism to work. So if it gets real wet with and more liquidy with the drop, then it can kind of almost slide out, or the ear canal normal skin will help kind of push it out. But I come across patients who have really, really thick wax, and I'll have them use something to soften it up, and then when they come back and see me, I can get it out a lot easier. I might be able to kind of slurp it up with a suction or something like that. But yeah, there's going to be those folks who, for whatever reason, their ear just does not do a good enough job getting their earwax out. So I'm not saying that no one will ever need that everyone is fine, doesn't need to get their ears cleaned or flush it out on their own. Like I said, I'm fine with flushing it on your own at home if you'd like. Or I'm fine with your regular doctor flushing your ears. That's not a problem. I don't often see that work well, though. I see a lot of people who come to me after their ears are flushed and they still have a lot going on. So that's why I don't flush actually ears. I tend to either scoop the earwax out or wait for it to get softer and then kind of vacuum it out, as opposed to, I've seen some things go wrong with flushing the ear as well, so I just don't do that too often.
How about use a Q-tip?
Next question. Make sure he gets our card. My take-home message is no Q-tips. You had a question up front here, man?
Have you heard of eczema in the ear?
Yeah, so he was asked about eczema of the ear canal. Eczema is a condition. Eczema is actually an allergic condition of the skin where the skin gets red and itchy in certain places. So you'll hear the generic term eczema of the ear canal in people who have dry skin of the ear. It technically may not be eczema, but I use the same term when someone comes in with dry, flaky skin of the ear canal. And so that's a common cause of ear itching. It can also lead to buildup because the dry skin doesn't want to. The dry skin mixes with your wax and causes the ear canal to get blocked up. But that is a common problem. People who have itchy ears tend to have dry skin. That gentleman mentioned sweet oil. That's a nice. I have people use olive oil because if you're in the kitchen cooking, you might as well just put a couple of drops in your ear. But olive oil, mineral oil, sweet oil, any oil is a nice lubricant for the skin. If that doesn't work for people, then I will sometimes prescribe a prescription medication that has oil and a little bit of a steroid medication, because we usually use steroid for eczema or psoriasis or skin rashes. So a little bit of steroid in the ear drop can keep the itching down. It's not. There's nothing wrong with doing that. It's certainly good to have that checked out at some point in time. You ask a really good question. There is no sort of government backed. You have to get a colonoscopy when you're 50 or 60 or something like that. There is no government mandated or backed hearing screening guidelines, so to speak. If someone comes in and we do diagnose them with some degree of hearing loss, at that point we usually do recommend some degree of follow-up, like annual hearing test, something like that. There's no real mandatory reason to come and get your hearing test, unless, of course, you have anything that you think might be a symptom or some people telling you that you're missing out on something. But if if no one around you, or if you do not perceive you have a hearing problem, you probably don't have a hearing problem. That's, but it's always fine to come and get it checked out. That's not a problem.
I worked on the plane deck for 2 years. Didn't have nothing on my eye and nothing on my ear. Would it make you, I talk real loud, in other words, I don't talk quiet.
Sure, absolutely. We talked about exposure to loud noises, whether... What's that?
There won't nothing but noise.
Yeah. So, people in this group who are either through their employment or through military service or something like that, many of folks in this room were not in the military or employed at a time in which there was lots of guidelines in terms of keeping the ears protected. So a lot of the hearing loss in this room is probably due to a lot of noise exposure, and that absolutely can cause hearing loss.
Anybody else? All right. Well, we'd like to thank y'all for being here this evening. And if you want to see if I missed some things to put out back here, we do have their cards and some brochures back here so you can know how to get them and call. You can always call me and I'll put you in touch with them if you need them. So we certainly enjoyed y'all being here. Thanks.